Hello, I'm Giovanna Hamilton, and this is my head, ear, eyes, neck, and throat assessment. I have Monica here as my patient, and we are going to begin with a skin assessment. So Monica's skin is nice and smooth. She's brown in color, nice and warm. We're going to check for her skin elasticity and turgor. Skin's nice and elastic. I don't see any lesions. I do note one little like freckle right here by her right eyebrow and a little small little like freckle by her right cheek. We're going to now look at just her nail beds and her nail plates. So first I'm going to turn them over, look at the capillary refill in them because she has fingernail polish. Her capillary refill is intact and it goes back to regular color in less than 3 seconds. We're actually going to look at her cuticles. Her cuticles are nice. Pink, no signs of breakdown. We are now going to check for clubbing. So I'm going to have Monica put her thumbs together like this. And then I don't see any degree of clubbing there. Now we're going to look at Monica's hair. It's nice and brown. The scalp, I don't see anything on her scalp. Hair smooth. Any pain when I'm touching on your actual head?
No.
It's nice and smooth. I don't feel any like bumps or nodules. Okay, since I'm already touching her face, we're gonna do her eyebrows. Any pain when I palpate here by your eyebrows?
No.
What about your cheeks here?
No.
So we're just looking for her sinuses. Okay, now you're gonna feel me percuss right here and here. Okay, now I'll have you just look at me. Eyelids look nice and clear, no lesions. Eyelashes are fully intact. Just she has a couple eyelash extensions, but hair, no bumps or nodules. Scleras are nice and white. Under conjunctiva is nice and pink. Next thing we are gonna do is I'm just gonna have Monica open her mouth for me and close it one more time. And close it. Her TMJ, there's no signs of crepitus there. Now we're gonna look at Monica's ears. Her ears are nice and brown. Her auricles are nice and round. I don't see any skin tags or keloids. And then we're going to look on the opposite side. On this side, her auricle for her ears nice and brown and round. I don't see any lesions or skin tags here either. Next thing we are going to do is I'm going to feel for Monica's neck. So first we're going to have her move her head side to side. So you're going to turn and look that way for me. Good job. Then look that way. And then look up. And then back down. Good job. And then now I'm just going to feel for Monica's thyroid gland first. Okay, Monica's thyroid gland. I'm going to have you kind of move your head back just a little. Not all the way, but just a little bit. Okay. So you're going to take a drink of water and we're going to feel for that thyroid gland. So just swallow. Good job. And take one more drink again for me. Good. Okay. Thyroid's nice and soft, small. I don't notice any hard nodules or anything like that. Yeah. And then we're going to feel for Monica's lymph nodes. We're going to start with the ones in the back of the skull, occipital, which they're nice and soft. Then we're going to go to post-auricular, preauricular, submandibular, submental. Then we are going to work our way down to the anterior cervical chain. And then we're going to do the posterior cervical chain. Nice and soft there. And then we're going to do the supraclavicular. Don't feel anything there. Then I'm just going to listen and check for bruit. First I'm going to start with your temporal, then do your eyes, and then I'll do your carotid. Okay?
Mm-hmm.
Then I'm going to listen to both sides. No bruit. No bruit. I'm just going to have you close your eyes. Sorry, this might be cold. No bruit over the eyes. No bruit over the eyes. I'm going to listen. No bruit over the carotid pulse either. Okay, next thing we're going to do is I'm going to just kind of test your hearing. So first test is we are going to be doing the Weber test. And this is just, I want you to just tell me if you hear it in both ears. Okay? Next test, we're going to do the rind test, and this is just going to test for bone conduction. So I'm going to put this on the mastoid bone right here in the back of your ear, and then you're going to tell me when you stop hearing the sound, and then I'm going to hit it and put it next to your ear, and you're going to tell me when you stop hearing it, okay?
Okay. It's that.
Okay.
It's that.
Okay. Do on the opposite side.
It's that.
Okay.
It's that.
Okay, good. So normal findings for the rind test. Next, we are going to look into your ears.
Okay.
Put my light on. Okay. I'm gonna start with this side. So we're gonna pull the ear pinna up and back. We'll start with this side. Okay. Now looking in the eardrum. Tympanic membrane, nice pearly gray and white. Ear canal is nice and pink. No signs of earwax at all. I'm gonna take this out. Then we're gonna do the opposite side. And pull that pinna up and back. Tympanic membrane, nice pearly and white. And this one, just a little bit of earwax on the side, but the ear canal is nice and pink. No lesions. So I'm gonna switch the heads over real quick, and then I'm gonna do your eye exam next.
Okay.
So first thing I'm gonna have you do, Monica, is you're gonna look straight ahead at me, and then look at my nose, and I'm gonna shine the light in your eyes. Good. Good. Okay. The next test I'm gonna have you do is I'm gonna have you cover one eye. You look straight ahead at me. Good. Okay, then we'll do swap it. At me. Good. Okay, pupils are reactive to light and accommodation, and your pupil size is about 3 mm in size. Next test we are going to do is I am going to have Monica cover one of her eyes, and I'm going to have you see which fingers like you can see in view.
Okay.
So we'll start with your right, and I'm going to cover my right, and then tell me when you see my hands come into view. You're going to look straight at my nose, okay?
I see him. I see him. I see him.
Okay. We'll do swap eyes.
I see him. I see him. I see him.
Okay. Now, next thing I'm going to have you do is you are going to look at my nose, and then you're going to follow this gaze with your eyes. So we're going to start. Good job. This way. This way. Good. Keep your eyes on there. Good job. I'm going to take that from you. I'm pretty much got a little snowing chart. What do I do with it? I'm just snowing chart. Oh, thanks. Okay. Next thing we're going to do is the Snellen chart. So I'm going to have Monica first cover her left eye. And I'm going to have you read me the line that you can see the best.
LTFPH.
Okay, I'm going to have you uncover that eye and then do it on the other side. And then I'm going to have you read the line backwards. So starting from your left to right.
HPFTL.
Okay. Then I have you do it with both eyes open. And then I want you to read the smallest line that you can see.
LTFPH.
Okay. So chart is done. Monica is seeing 20/20. Next thing that we are going to do is I'm going to actually look into Monica's eyes. So I'm not going to look straight ahead at that photo on the wall, and we are going to start with your left eye. Okay? So we'll just look straight ahead. Straight ahead. Okay. I'm gonna get really close to you, so just don't jump. Right reflexes notice. Sorry, I'm a little close. No signs of macular degeneration. Okay. Your eye break. Let you blink, let you blink. Retina color was nice and orange. I didn't notice anything with the arteries. Veins were bigger than the arteries in the eye. So we're gonna do this side.
Okay.
Are your eyes okay?
Yes.
Okay, we're gonna go on this side. We're gonna look straight ahead. Do this eye. Okay. Red reflex noted. Good job. No signs of macular degeneration. Veins and eyes are nice and big, not bigger than the arteries. Retina color is nice and orange. Okay, eyes look good. You doing okay, Monica?
I am, thank you.
Okay. Next thing we're gonna do is I'm actually gonna look into your nose. And then we'll do your mouth. Okay. But first you're just gonna feel me. Palpate your nose. Any pain there?
No.
Okay. Pain there. First thing I'm gonna have you do is I'm gonna have you hold one of your nostrils down. I'm just gonna have you breathe in and out. Okay, good. Then we'll do the other side. Nasal patency is good on both sides. Patient is able to breathe. Now I'm going to pull Monica's nose up and back, and we're going to look in her nostrils. Starting with her left one. Her nostrils nice and pink, no signs of buggers. Septum is nice and midline, no deviation noted. A little bit of hair. Then we're going to do the opposite side. This side also no septum deviation. I don't see any drainage. Just a little bit of hair. No issues there. Okay, next thing I'm going to have you do, Monica, is I'm going to have you open your mouth. Good. Okay. Looking at the teeth. Teeth are nice and good. Oral mucosa is nice and pink. Lips are pink. Tongue is nice and pink. I'm going to have you lift your tongue all the way up to the roof of your mouth. Good. Gums are good. I'm going to have you go, nice and big. Good job. Uvula is nice, pink in midline. Open it one more time. Tonsils are intact. And then we're going to just elicit the gag reflex. Monica's gag reflex is intact. Don't actually gag for me. And I think that completes my head and neck and throat assessment.
Thank you.
Thank you, Monica.
Thank you,
Do you have any
Giovanna.
questions?
No, thank you. Thank
Your
you for
exam
your time.
came out great.